And also, we elongated her chin a little bit. With this slightly more pointed chin apex, we changed her facial shape from a rectangle or oblong to a more ovoid shape, which is more feminine. And also, the radius in her anterior medial cheek. With this projection, you create an illusion of lifting in the mid-face to make her look more energetic, younger, and more attractive. And when we first started to use Radiesse more than a decade ago, we didn't know it can be also used to facial soft tissues, because in the beginning, we thought that Radiesse is a very stiff filler. It's a strong product. So we were afraid that when we use it to facial soft tissues, like in the anterior cheek, in the lateral cheek, it might be too stiff and it might not be that natural. But as you can see, that as long as you inject the product to the right layers, and as long as you disperse the product evenly, you have no problem. The patient can still make their facial expressions very naturally. And actually, when they feel it, if you disperse the product evenly, the touch to the skin is actually very good. But why do we need to use Radiesse for facial contouring or volumization? There are so many other HA fillers in the world. What is the benefit? What is the reason of choosing Radiesse? So one of the unique feature of Radiesse is that it has one of the highest G prime among all the fillers. Its elastic modulus is 1,300 Pascal, which is one of the most among all the fillers in the market. And with this very high elasticity, it gives you a very sharp, very effective projection. And I believe you know that if you choose something that is not strong enough to inject to the nose, and with time, this softer HA filler will get softer, and it will create unnatural widening of the nose nasal root, just like this. But other than noses, another area that will have a similar problem would be the chin. Like in this patient, when you look at her chin, you know that this is difficult because you can see the dimpling, implying that she was constantly activating her mentalis muscle. Her mentalis muscle is hyperactive because of the retrusion of the chin apex. And you can imagine with this very tight chin, if you try to pinch her chin in between your fingers, you are not going to pull the soft tissue forward because it's just too tight. So for this kind of very, very tight chin, you know that most HA fillers will not be strong enough to project the chin to the way you want. And if you choose something that is not strong enough, you will end up with a very big ball in the chin, which is not aesthetically pleasant, which is not what the patient wants. So for this kind of very tight, very difficult chin, I would go for Radiesse. With its very high G prime and high elasticity, it is able to shape the chin to bring the apex toward the direction that you want to create the best definition that this patient can have. And not only to nose and chins, this kind of projection, sharp projection, is also important when you treat the anterior medial cheek, when you treat the midface, especially for patients with wider midface. This is a common feature in Asian faces. So like in this lady, she had a pretty wide midface. The volume in her midface was not that deficient. However, she can still use some more projection in her anterior medial cheek, the apple cheek, to improve the infraorbital hollowness. But you can imagine that when you recommend a filler to project her midface, she might say no. She would say that my face is big enough. Okay, and if you add more filler to my mid face, it will make me look fatter. It will make my face look even wider than before. So that is when you need something that is very strong. With this very high elasticity of Radiesse, what you can do is to use only a very limited amount of the product for a very sharp projection in a narrow area of the face. So that after this injection, you can see that we projected her mid-face forward. This also improved her infraorbital hollowness without making her mid-face looking wider. So that before and after injection, you can see the most protruding part of her mid-face had been elevated, but not widened. Okay, so creating a visual effect of lifting. So this is one of the most important aspects of using a very sticky, very elastic product to contour a small area of the face rather than generalized volumization. Okay, and one more area where I found Radiesse to be very interesting is in the forehead. Asian forehead are usually more receded compared with our supraorbital ridges. So you see frequently in our patients in between the frontal bossing and the superior orbital ridge, you see a depression in the forehead. So frequently we were asked to smooth out this depression to create a smooth forehead. And most doctors would use HA fillers for this indication, which is okay, but it does have some drawbacks. Okay, so in this video, this is a patient injected with HA filler. I think 6 months or 1 year before, I didn't know which product it was. I didn't know the injection technique, but you can see that after a few months, you can still push the HA fillers from here to there. So it's not integrated well within the tissue. And although this problem can be avoided by either a better choice among the HA fillers, you can choose something with a better cohesivity, or you can choose a better injection layer. This would resolve this problem, avoid this problem. But another problem that is difficult to overcome is the touch, is the feel to the forehead. Sometimes when we want to project the entire forehead, you want to create a very full and beautiful forehead like this. With HA filler, you will need 3 cc, 4 cc, 5 cc, or sometimes even more of the product to the entire forehead. And with this amount of volumization, if it's an HA filler, when you feel the forehead, it will feel too soft. It feels like a water balloon. And when you press it, you can leave a dent on the surface. Okay, so although with HA filler, indeed, you are able to create a visually pleasing contour in the forehead, but the feel is just too soft, and the patient complained about that. So this is a patient before and after Radiesse to her forehead. And the benefit of using Radiesse here is that when you feel it, it feels like a true forehead. The firmer texture of Radiesse is very genuine on the forehead. Okay, so you can see that after forehead contouring, when we reduced the depression above her superior orbital ridge, this full and rounded forehead really made this patient more feminine and younger than before. But although I love to use this product in the forehead, however, I still want to stress that forehead is an area that carries a higher risk of embolization. So I don't want you to jump into forehead injection too quickly if this is not something that you are already familiar with. You do need a full training before we go to the forehead because of the supratrochlear artery, supraorbital artery. They all have connections to our ophthalmic artery. So we know that this is a high-risk area, and many cases of blindness had been related to forehead injection. But if you are already doing forehead injection with HA filler and you are quite familiar with it, then I encourage you to try Radiesse, and you will like the result, you will like the feel. Okay, so if we are going to use Radiesse for as a filler to contour the face, is the injection technique different from when we use HA fillers? When we talk about injection technique, basically we talk about to a certain location, to a certain injection plan, how much product you use. So the injection plan of Radiesse, to your right, you can see that you can inject Radiesse either in layer 4, below SMAS, on the supraperiosteum, or you can inject it above SMAS in the subcutaneous fat layer. But just like any other soft tissue fillers, we don't recommend you to inject the product into the muscle, because with the contraction, the movement of the muscle, it tends to be squeezed away from where you implanted it, and it carries a higher risk of nodules or lumps. But that is not only for Radiesse, it happens to any soft tissue filler. You don't inject any soft tissue filler intentionally in the muscle layer. And also, you don't inject Radiesse intradermally. It is not intended for intradermal injection. One reason is because it's firmer, so it's more likely to leave a lump, unevenness when you inject too superficially. And secondly, because the product is white, so if you inject too superficially, you can see the white color of the product against the skin. So you can use it just like any other high G prime products. You can inject it very deep on the supraperiosteum, like what I did here. But one reminder, most doctors would use a 27 gauge short needle for bolus injection for Radiesse. Radiesse is very sticky. So when your needle is primed, is filled with Radiesse, it is too sticky. The aspiration is not effective. It is too sticky to allow the blood to be aspirated back into your syringe. If you want to use aspiration to check whether your needle is intravascular or not. So if you want to do this aspiration maneuver, the only way is when the needle is empty with filler, or when the needle has some lidocaine within it. I mean, some doctors have this habit of aspirate a little bit of lidocaine in the needle before they inject. So only with air or lidocaine, those kind of very thin fluid, you are able to aspirate. Once the needle is filled with Radiesse, it is too sticky. So it's not reliable. So if you are going to do this maneuver, you don't use it in very high risk areas. Or superficial injections. So we talked about how that you should not inject Radiesse too superficially. So this is too superficial. You can see the needle was tethering the dermis. You can almost see the gray color of the needle. So that's too superficial, but this is okay. This is subdermal. This is in the superficial layer of the of layer 2. And when you do injection with a needle in that layer, keep your needle moving so that it reduces the risk of intravascular injection, because your needle is constantly moving. Even if it goes into the blood vessel at a certain time point, it's not too much. Okay. And the situations when I would use a blunt cannula for Radiesse is when I need to feel a larger surface area. Like in this gentleman, you can see that he had depressions in his mid-face, which is quite wide in distribution. Or when I need to do a larger area of projection, like to his chin, which is very retruded and very short. And this kind of situation, I would use a cannula. I prefer a 25 gauge cannula. And in his anterior medial cheek, I was delivering microboluses to the area where I think he needs some projection, because the deficiency that he had in his midface was rather wide. If I use needles, I need multiple punctures, and that will increase soft tissue damage and increase tissue trauma. So I would choose a blunt cannula. And also to his chin, I know that most doctors would use a 27 gauge short needle for bolus injection to the chin. I do that sometimes, but in this gentleman, because I believe he would need more volume, and I wanted to give him uh, a better projection in the chin. I have this hypothesis that if you inject Radiesse in a very large bolus, it's not the best way to use it, because in a very large bolus, most of your calcium hydroxyapatite microspheres are not in direct contact with your soft tissue. So their ability to generate new collagen is more limited. So if you want to have a longer sustainable result, I believe it's better to try to disperse the product more evenly within the soft tissue to allow the microspheres to get in contact with your soft tissue as much as possible. So if I want to do that, a blunt cannula is much less traumatic than a sharp needle. So those are the situations that I would use blunt cannulas. Okay, so this gentleman, after we provide support to his midface and we projected his chin, we reduced the sagginess in his midface and lower face to make him look more energetic and more handsome. And regarding the injection volume, should we undercorrect? Should we overcorrect with Radiesse? So let's take a look at this lady in her 50s. You can see quite prominent sagging in her midface and lower face. This is a surgical candidate, but we decided to do minimally invasive procedures to improve her condition. So actually, I started with art therapy, and we used 460 lines of art therapy, combining 4.5 and 3.0 transducers. And this is 3 months after art therapy, and you can see that the art therapy had reduced the bulging in her jowling. And then we continued with injection. So to her lower face, I started with Radiesse, or 27 gauge sharp needle, for bolus injection to the chin apex. And then to her preacher sulcus, I use a 25 gauge cannula because I expect to meet the inferior labial artery, the labial-mental artery, and even the submental artery along the way. So I believe that a 25 gauge blunt cannula is safer. When I do a multi-layer injection, I inject both in layer 2 and layer 4 to her preacher sulcus. And I also used a little bit of Radiesse to her mandibular angle to try to compensate for the bony loss that is expected to happen with age. But of course, for Asian ladies, we do this injection much more conservative. We don't want to add to the bizygomatic width to our Asian ladies. So that after this combination treatment, we were able to improve the sagginess to her lower face to a great deal. And we changed this wavy jawline into a straight line so that the sagginess in her lower face improved a lot. But regarding the volume to be injected, this is before, this is immediately after injection, and this is 4 weeks after injection. So if we compare the right two pictures and we look at her chin apex, we look at her preacher sulcus, you can see that compared with the immediately after photo, 4 weeks after injection in her chin apex, in her preacher sulcus, those volume had somewhat decreased compared with what we see right after injection. The reason is that with Radiesse, about 5 minutes, 10 minutes after injection, you started to see some swelling. And the extent of swelling is slightly more than what you see in HA fillers. So when you judge your injection endpoint, this is something that you need to take into consideration. So I would recommend that when you use Radiesse as a filler, you can do a full correction. You don't have to undercorrect. But still, we don't recommend you to do overcorrections because that would cause too much swelling in the recovering phase, and the patient will not like it. So full correction is okay with Radiesse. Okay, but a reminder that Radiesse should not be used in the lips or in the glabellar lines because to these regions, you either inject under very thin soft mucosa or you inject very superficially. And the firmness of Radiesse is going to cause lumps. So this is not a good indication for Radiesse. And also, well, we recommend you to avoid very dynamic areas such as intramuscularly in the perioral and the periorbital region. For the same reason that we talked before, you don't want the muscle contraction to gather those products into lumps, into nodules. And again, other common precautions as you inject other soft tissue fillers. Okay, so what we talked before were all about in using Radiesse as a filler. But it's also a biostimulator, and it had been proved to help us to increase collagen fibers, increase elastic fibers, to make the dermis thicker, and also cause new blood vessels to grow. However, it doesn't mean that if you inject Radiesse under patient's skin, you automatically have the benefit of biostimulation. Like in this picture, when you inject Radiesse deep like this, even if there is some neocollagenesis, it is not going to help your patient's skin because those collagen fibers, those elastic fibers are just too far down below the skin. It is not going to help with the skin texture. So if you want to benefit from biostimulation, you need to inject superficially enough so that those neocollagenesis is able to improve the skin quality. But we just said that with Radiesse, because it's firmer, you should not inject too superficially under the skin, or you will see lumps, or you will have the white color of the product showing through the skin. So how to overcome this problem? So we dilute Radiesse. We use different dilution ratios depending on the indication, depending on the thickness of the skin. So after you dilute Radiesse to make it a very thin and watery solution, then you are able to inject the product very superficially, lay down a thin layer of skin. But this is a 1 to 2 dilution, and you can see that after mixing with normal saline and lidocaine, it turns into a very thin, very watery solution. So it is perfectly okay to be injected superficially under the dermis, and you will have no problem. And during the past few years, there are more and more clinical studies looking into how to use this diluted or hyperdiluted Radiesse for different areas of our body. Like in this study, they used hyperdiluted Radiesse, 1 to 2 dilution, to rejuvenate the lower face and mid face skin texture. So it's 1 to 2 dilution, and 1 syringe of Radiesse per session. They did only 2 sessions, 3 months apart, and they use a 25 gauge cannula to fan the solution across the entire mid face and lower face. And you can see from the before and after photo what they got after only 2 syringes of product separated into 2 sessions. And the cellulites in the buttocks. In this study, they divided the problematic area into 6 parts: the posterior hip, the lateral hip, and also the posterior thigh. So both sides, they had 6 different areas to be treated. So they started with 300 lines of therapy delivered across these 6 treatment regions. So considering this large surface area, 300 lines is actually very few, very low in density. And they used 2 syringes of Radiesse per treatment. They diluted the product 1:1, which means 1.5 cc of Radiesse plus 1.5 cc of lidocaine. So you have a total of 6 cc, 6 cc solution, and they use 1 cc solution to each of these 6 treatment regions, and with again a 25 gauge blunt cannula, fanning or linear threading across this region, so that 3 months after treatment, you can see that the number of depressions, the depth of depressions, they all improved, and 95% of the patients were satisfied with this treatment. Or sometimes patients present with laxity, wrinkles above their knees in the lower thigh. And in this study, they used 1 syringe of Radiesse to one side of the above knee, and they did hyperdilution, 1:4 ratio, which means that they add 6 cc of diluent to dilute 1 syringe of Radiesse, and again 25 gauge cannula to fan the product across the lower thigh. And 3 months later, they can see improve in skin texture, reduction in the wrinkles, in the depressions in the patient's knee. And recently, Dr. Lim from Singapore, she published how she treated stria distensa across different regions of her, the body in her patient. She started with a therapy from 480 to 800 lines, combining 3 different transducers. And then right after a therapy, she injected 1:1 diluted Radiesse to again with a 25 gauge cannula and fanning across the problematic region. And after treatment, they can see that the width of the stria decreased. They can see that the shiny matte texture of the scars improved, became less shiny, and also the depressed appearance of those stria distensa got flattened after treatment. And what is interesting is to see the improvement with time. So from baseline to 1 month, no improvement, but the improvement started to show 3 months after injection, and got even better 6 months after injection. And the importance is that it means the result that we see is not the immediate volume effect, but rather the neocollagenesis, which happens only after a few months and it gets better and better with time. So in the above studies, these authors, they used different dilution ratios. So these are the terms of definitions. When the dilution ratio is smaller than 1:1, we say it's minimally diluted, which means to 1 syringe of 1.5 cc Radiesse, you use a diluent lower than 1.5 cc. Sometimes it's 0.3, sometimes 0.5. And for 1:1 dilution, it's called diluted. And for dilution ratios higher than 1:2, we call it hyperdilution, which means that to 1 syringe of Radiesse, you use 3 cc or more diluent to dilute it. So the problem now is, what is the best dilution ratio to be used? What kind of dilution ratio gives you the most neocollagenesis? So Casabona did this interesting study that to one lady, she injected, she tested 6 different ratios of dilution from 1 to 0.16 up to 1 to 6.5. So across this very wide range of dilution, and she found out that the dilution ratio of 1:1 give the highest amount of new collagen formation, but this is only one patient. Another study, they compared 1:2 versus 1:8 dilution, and the conclusion was that these 2 dilution ratio were pretty similar in collagen and elastin fiber generation. So so far, we don't have sufficient data to tell you that a certain dilution ratio is definitely better than the other. So you need to choose the one to work with that you find most comfortable. I mean that it will be based on the situation of the patient, the indication, how thin the skin it is below your injection, with the principle that the higher the dilution ratio, the more you dilute it, the smaller volumizing effect you get. So it's safer to avoid nodules with higher dilution, but that also means that you need more treatment sessions to achieve the same degree of improvement. Okay, but we do have some guidelines for you from the consensus. If you are treating the laxity in the buttock skin, the dilution ratio may be higher, 1:2, 1:4. But if you are dealing also with the depressions from the cellulites, then to those depressions itself, you can use some more volumizing effect. So that is where you can use somewhat lower dilution, for example, 1:1, to feel those depressed dimples. And to the arms, if you have a patient, like in this picture, very creepy and thin skin, then you go for a higher dilution ratio. So in this patient, this is almost 1 year after 1:4 dilution or 1 syringe to this side of her arm. And to the neck, very thin skin there. So I would recommend you to use a 1:4 dilution ratio. And you can use either blunt cannula to fan the product across the neck, or you can use a sharp needle, either a 27 gauge or 30 gauge for short linear threading injection, also across the entire neck. And above knees, 1:4 dilution. Usually you would need 1 syringe to one side of the above knee area. And in the abdomen, if you need to treat the entire abdomen, then you may need 1 syringe for each quadrant, which means 4 syringes to the entire abdomen. But to most of our patients, you would see that the wrinkles are mostly centered around their umbilicus or in the medial part of their abdomen. So most patients, I would recommend them to buy 2 syringes of Radiesse and dilute it 1:1 or 1:2, and to distribute the product evenly across the area where I see more stratus tensa or more wrinkles. Okay, and to cellulite, to stratus tensa, because we also need some more volumizing effect to fill in the depressed area. So you go for a lower dilution ratio, 1:1. Okay, so regarding the protocols, how much session the patient need, and how to space between 2 sessions, before how long can we see the improvement? From the study, we know that after 4 months, although we know that after only 1 month, the elastic fiber and the collagen fiber started to grow. And at 4 months after treatment, we can see a significant increase in both type 3 and type 1 collagen. And after 9 months, most of the collagen had been switched to type 1, which means the result is very stable. And from most of the published studies, we know that after 3 months, most of the patients can appreciate their improvement. So I would say that you can space your treatment roughly between 2 to 3 months with each other. And depending on the situation of the patient and also on the amount of product you use in each session, usually you need 1 to 3 sessions to get a good result. And then after that, you can maintain the treatment, repeat treatment every 12 to 18 months after that. And how to dilute the product? We would use a female adapter and also Lurolux syringes. And to dilute the product, you can use the lidocaine with or without epinephrine, but try to limit the total amount of lidocaine to lower than 1.5 cc. Sometimes you need more diluent, whether it's because you are going for a higher dilution ratio or you are just using more syringes of products. When you need more volume of diluent, we use normal saline to add up to the total amount of diluent that you need. this is to avoid too much lidocaine and the lidocaine toxicity. And at least 20 passes between the two syringes. Usually I would do 30 to 40 to make sure the suspension is very even. And of course, you need to use sterile technique to avoid infection. And after mixing, you use the suspension as soon as possible, because if you sit the suspension still on the table, you will see that it separates, precipitates very quickly, especially at higher ratios. So that after you injected one syringe, when you are going to inject the next, you remember to agitate the syringe before you inject, so that the suspension is even. And use how to judge how much product to ask your patients to use. A general rule is that one syringe of pure product is going to be used to an area of 100 to 300 square centimeters, or a simpler rule is that one palm size, one syringe of product of undiluted product. And you can use either cannulas or needles. And here the consensus recommends that you inject 0.1 cc per pass per line, and you space two lines 2 centimeters between each other. But what I do is I tend to space those lines even closer to each other and decrease the amount of each pass, so that I don't need to massage too much. The injection layer is subdermal. You can go actually very superficial under the skin, so that you have more effect on the superficial skin. So this is what I usually do to the abdomen. This is Radiesse hyperdiluted 1 to 2. And I was using a 27 gauge 1 inch needle. I'm sorry, 3/4 inch needle. And just do a linear threading or fanning superficially under the skin. Of course, you can also use a blunt cannula. If you are trying to use a blunt cannula, I would recommend that you use a 23 or 22 gauge, because when you try to drive your cannula under the belly skin, you will meet a lot of resistance from the fibrocepta in the adipose tissue. And a thin cannula, such as a 25 gauge cannula, can bend very easily when it gets into touch with those adhesions. So it's easier to use a more robust cannula, like a 22 gauge cannula, but I prefer to use sharp needles because it's much faster. You don't need to open pre-holes. You don't need to manage those resistance from adhesions. So it's much faster, much easier. And since it's belly, so you don't worry too much about bruises. And after injection, massage immediately to ensure even distribution of the products. And massage, you can also ask the patient to massage at home twice a day. And other general guidelines, just like any other soft tissue fillers. Okay, and in Asia, we don't have that much décolletage or cellulite, but sometimes I use Radiesse to treat the acne scars. Like in this patient, you see pores, you see some wrinkles, you see acne scars. So to this patient, I started with a therapy. I used a combination of 3.0 and 1.5 millimeter transducers. And after that, I used 1 to 2 hyperdiluted Radiesse, 1 syringe of Radiesse to 3 cc of diluent. And I remembered I used about 1.1 cc of the diluent to one side of his cheek. And I tried to inject the product as superficial as possible. Sometimes it's not that easy because you will meet the adhesion from the scarring, from the acne scarring below his dermis. So sometimes it feels like subcision. You need to get your cannula across those scarred areas. But the aim is to try to lay down a thin and even layer of Radiesse across his cheek. So that after this combination, this is 3 months after the combination treatment. So you can see that the acne scar became shallower. You can see the pore size is reduced. You can see the wrinkles reduced. So it's overall improvement in the skin texture. But you can also see that the better results we see are for the rolling scars. Still, those ice pick scars, those boxcar scars, they respond less compared with the rolling scars. So this combination of therapy and Radiesse is not going to replace all of your other weapons for acne scars. You still need other ablative lasers or cross technology or subcision to treat your acne scars. But I would say that this combination of therapy and hyperdiluted Radiesse, it actually carries a less downtime compared with ablative fractional lasers, where the patient will have scabs for a week and then post-inflammatory eczema and the PIH for a couple of weeks. So this is actually easier for the patient. And also this would be a good choice for patients with a more generalized skin problem when he or she has acne scars, pores, and the wrinkles across a larger surface area. So this combination gives you a more generalized improvement in the overall skin texture. And also to the bellies, we have ladies after pregnancy and laxity in the belly, and you can imagine that this lady would be reluctant to wear swimsuits when she goes to a swimming pool, and she may not even want to take off her clothes even before her partner. You can imagine how she would not like those wrinkles. So what I did was that I used a dual plan of treatment with therapy, combining 4.5 and one of the shallow transducers to one side of the belly, and then one-to-one dilution of Radiesse to those wrinkles. So this is 3 months after the combination treatment, and you can see that after treatment, the wrinkles improved. So although after only this one session, we are not able to eradicate all the wrinkles, but these wrinkles, the skin texture did tighten with less wrinkles and better skin texture, better light reflectance. And in the face, where I prefer to use hyperdiluted Radiesse is to inject to the subzygomatic cheek or the submalar cheek, because this is the area where I wanted not only the volume effect, but also some neocollagenesis to improve the skin texture. So to ladies, usually after 45 or 50 years old, when I see depression in submalar cheek, when I see laxity in their jawline, especially when I see some skin texture problems, wrinkles, dryness in the skin, that is when I would recommend hyperdiluted Radiesse to address the problems there, so that I can have the benefit of a moderate volume increase and also skin texture tightening and improvement. So, and I'm going to use this lady as an example to show you how we can use the versatile dilution ratio of Radiesse to address different problems in the face. So this lady, as you can see, she has many soft tissue deficiency in her face, in her temples, in her mid-face, in her subzygomatic cheek, so she looked thin. But when I asked her, which part in your face bothers you the most, she said that she didn't like those wrinkles when she smiles. So those dynamic accordion wrinkles, we know that this is the result of weakness in the skin, because the skin is getting thinner and thinner in the dermis and also in the superficial fat pads as we age. Okay, so our aim was to increase the strength of the skin, to increase the thickness of the dermis. But when we try to use fillers to do that, we have to be careful, because those wrinkled area is where the jaw fat pad is. So you don't want to increase the volume over that wrinkled region too much, or you will increase the volume of the jawline and making the make the sagginess looking worse. But she does have some volume deficiency at other areas of her face. So to those areas where she needed more volume, we would use Radiesse, either pure or with a lower dilution ratio to increase the volume. But to the wrinkle area, to the accordion lines where the jaw fat pad is, we use hyper-diluted Radiesse. We use a more diluted version of the product so that after treatment, you don't really increase the volume over there, but you can have a stronger skin, you can have a thickened dermis, so that will improve, that will reduce the dynamic accordion lines over that area. And because it's hyperdiluted, so the volume overlying that jawline is not getting worse. And she can also benefit from the lower diluted version or the pure Radiesse for volumization to her mid-face, to her subzygomatic cheek, to make her look more beautiful, more feminine, and healthier. So I do have some content for hands, but I'm not sure do we have enough time or not. So Yan, do you think that we continue with hand or we stop here for Q&A?
Yes, Dr. Tseng, I think we can continue with hands.
No problem. Okay, so let's talk about hands. Okay, so as we get older, from left to right, as we get older, you see that we see pigment spots, we see roughness in the skin, wrinkles, dryness, and also atrophy in soft tissue in the dorsal hand, so that the veins, the tendons gets more and more prominent. So this is the Merz hand aesthetic scale. It divides the aging of dorsal hand from grade 0 to your left to grade 4, very severe loss of fatty tissue to your right. So before we go to the injection part, we need to first understand the layered anatomy of the dorsal hand. So in the dorsal hand, below the skin, we have dorsal superficial lamina, dorsal superficial fascia, dorsal intermediate lamina, dorsal intermediate fascia, dorsal deep lamina, dorsal deep fascia. It feels like tongue twister. So I'm going to make this easier. So let's divide the dorsal hand layers into 3 floors. We have the superficial floor here, we have an intermediate floor here, and we have a deep floor here. So the ground of each floor, we call it fascia. It's fibrotic tissue. And what occupies each floor are the fatty tissue. Here we refer to them as laminas. Okay, so you have superficial lamina, superficial fascia in the superficial floor, just that simple. Okay, so in the superficial layer, you don't have vital structures. In the intermediate floor, you have dorsal veins, you have cutaneous nerves, and in the deep floor, you have extensor tendons. Okay, so in this cadaver, when the skin is reflected, you can see a very thin layer, almost transparent layer of superficial lamina. And when the superficial lamina and the superficial fascia are reflected, you can see the veins in the intermediate floor, in the intermediate lamina. And in the same layer, in the same intermediate lamina, but in a slightly deeper location, you see the cutaneous nerves. So both the veins and the cutaneous nerves are in the intermediate floor, in the intermediate lamina, but the veins are more superficial, nerves are slightly deeper. And when the intermediate fascia are reflected, what lies underneath are the extensor tendons. Okay, so again, skin reflected, and when they reflected the superficial fascia, you see the veins and the nerve underneath in the intermediate lamina. And when the intermediate fascia are reflected, what we see are the dorsal extensor tendons of the hands. Okay, so when we inject the dorsal hand, the potential dangers that we want to avoid include the dorsal veins here. In this fluoroscopic picture, they accidentally cannulated the dorsal vein. So you can see the contrast in the vein, and we don't want this to happen to our patients. And slightly deeper than that in the intermediate lamina, there are cutaneous nerves. And even deeper than that, we also don't want to inject our blue filler like here, adjacent to the extensor tendons, or it might affect a normal function of your fingers. Okay, so it looks straightforward that the dorsal superficial lamina is our target layer to be injected. So traditionally, this is what they teach you. You pinch the skin up, you slide in your cannula or your needle so that you may access the superficial lamina. But is that true? The skin on the dorsal hand is very thin. The thickness of skin there is only 0.2 to 0.9 millimeter, which means that the dorsal superficial lamina is less than 1 millimeter down the skin. So are we really able to get to that very thin layer just by tenting the skin? So in this cadaver study, when Kotofana pinched this skin, you can see that the veins, the intermediate lamina, were also elevated, which means that this is bad. This is not able to help you go to the superficial layer. You will go into the intermediate layer like this. Another of our friend, Dr. Kim from Korea, when he pinched the skin, cut off this piece of skin and sent for histologic study, you can see that the dorsal superficial fascia was in the excised skin, which means that when you pinch the skin and you go in with your cannula, you are not superficial to that fascia, but deeper to that in the intermediate lamina. So he tested two different injection techniques. One, he pinched the skin first and then slide in his cannula. Two, without pinching the skin, he inject directly. When he pinched the skin first, he discovered that his radius was deposited in the intermediate lamina, which is not what we hoped for, but fortunately, these products were more superficial than the veins and then the nerves. So although they are in the intermediate lamina, they were not in direct contact with those vital structures. But without pinching, he found the product to end up in between the extensor tendons, which is even worse. So he recommended you to inject after pinching the skin, then you go in with your cannula, but he recommend that when you inject, you try to tilt up your tip of cannula to scrape the undersurface of the skin, so that even if your cannula is in the intermediate lamina, but they are slightly above the veins and nerves, and to avoid damaging those vital structures. But could there be another way that we can access the dorsal superficial lamina, like what is showed in this cadaver study recently? So you can see that the green colored filler are superficial than the superficial fascia. So how did they do that? So what they did different in this study was that they inserted their cannula from the proximal part of the dorsal hand around the wrist. But what Dr. Kim did differently was that the insertion point was more distal, in between the metacarpophalangeal joints. Okay, and how did these two entry points make difference? What we know now is that in the distal 1/3 of the dorsal hand, the separation of the layered anatomy is less distinct. The separation is not that clear. So if you enter from distal and go proximal, it's more likely that your cannula cannot find the correct layer. But if you enter from the proximal hand near the wrist, you are more likely to get to the more superficial layer as we wished for. Okay, so in so far the published studies, 114 subjects, and they used a 27 gauge needle to inject boluses of Radiesse in between the metacarpal bones, and then they massage the products to make the products more even. And after treatment, they can see the improvement for 1 grade or for 2 grade in other patients. And these are the GAIS scores. And 6 months after treatment, more than 70% of the patients were still at least 1 grade improved compared with baseline. Another study, they compared 2 different techniques. One is 27 gauge needle, microboluses injection and massage. Second, 25 gauge cannula and the fanning across the dorsal hand. And they see improvement in both techniques, and the trend of improvement was similar between the two. And another study, again, they compared 27 gauge needle injection versus 25 gauge cannula injection. And with either technique, they see improvement in the thickness of the dermis and also in the density of the dermis. Both technique gave you increase in collagen, and both injections were able to improve the Merz hand scale and to improve the GAIS score. But patients tend to favor a cannula technique more than the needle technique. And the possible adverse effects in this study, after 3 months, they tested the pinch stress, the grip strength, and the range of motion of their metacarpophalangeal joints, and they didn't find any abnormality in hand function. But they do see quite a few injection site reactions, including bruising, swelling, redness, and the ratio here was high, 80%, 90%. It's higher than what we see clinically. I believe that's because that in this study, they did a needle injection, but now we use cannulas to do this much more often. So we see lower rate of adverse events. And in this, so far, the biggest retrospective study across 11 years, they had 220 patients injected to their hands. So they compared 4 different techniques. So with bolus technique, it means that they did 1 big bolus injection, 1 central injection, and they massage the product across the hand. The tenting technique means that they pinch, they lift the skin, and the micro boluses with sharp needle across the dorsal hand. Distal to proximal, this is the Dr. Kim's technique, going from distal, blunt cannula, and going proximal, or the other way around, blunt cannula again, proximal entry point, and then go distal. And they found the complication rate to be different for both of the needle technique and the distal technique with cannula. The complication rate were high at 25%. However, at the proximal to distal fanning technique, only less than 1% complication rate. So you can imagine that with needles, because needles cause more trauma and needles don't respect layers, so you are more likely to damage the tissue. You're more likely to go to a deeper layer with needles. This explains why the complication rate is higher. And with the 2 cannula technique, as we explained earlier, that if you enter from distal, you are more likely to go into the wrong layer, because the separation of layer here is less distinct. So we recommend you to go from proximal to distal. So nowadays, when I do hand injections, I would likely elevate the skin. I would not grab the skin. If you grab the skin like this, you will also elevate the intermediate lamina. So you just pinch the skin lightly. And after that, slide in the cannula and try to align your cannula as parallel as to the skin surface as possible, so that hopefully we can be in the superficial lamina. And if you don't, you will be in the intermediate lamina. But as long as you slide your cannula gently, you should not have a big problem. and then fanning across the entire hand. And when your cannula gets into contact with larger veins like this, it may look scary, but if you are in the right plan, you can see that your cannula actually overrides your veins. Okay, so you can go across it with no problem. But still, try to keep your cannula very parallel to the skin surface and gently fanning the product across the entire hand. Okay, so this is this patient. 4 weeks after injection, we can see that after Radiesse, we reduced the concavities in between her metacarpal bones, so that the veins, the tendons look less obvious and the skin texture improved. So about the volume of injection, if this patient started with like a grade 2, grade 1, mild to moderate loss in fat tissue, I would use 1 syringe of Radiesse. My habit is to mix 1.5 cc of Radiesse with 0.5 cc of lidocaine. So I have 2 cc of product, and then I use 1 cc to each side of the hand. But if this patient started with a grade 3 or grade 4, severe to very severe soft tissue loss in the dorsal hand, then I would recommend the patient to get 2 syringes of product, and again 0.5 cc diluent to dilute 1 syringe, and then I use 1 whole syringe of the product to each side of their hand. So this is this patient a few weeks after. So this is a 2-grade improvement from grade 2 to grade 0. You can see that those most of the veins, most of the tendons are not visible now. Okay, but for patient who started milder, like this is probably a grade 1, younger patient in her 40s. So this kind of patients, you may need only 1 syringe of product to divide to both hands, so that we can see that we camouflage the tendons, the veins, and also have some improvement in skin texture. Okay, so that's it. As you can see that Radiesse is really an interesting product. It can be used as a filler, as a biostimulator. It can be used almost to every part of your body for different indications. So in addition to use it as a filler, as like what you do with HA filler, I encourage you to try to use it to other areas, to other indications, to solve the problems that your patients gave you, which you didn't have a good solution for in the past. So I'll hand the time back to Yan, to Chongbin. Chongbin, you are mute.
Thank you for reminding me. Thank you, Dr. Tseng, for sharing with us this morning. And it's really impressive to see that how the usage of Radiesse has evolved from the beginning of the time when it was first introduced in Asia Pacific, where we use it more of like a liquid filler for nose and chin, which we had good effect with it, to a lot of facial sculpturing indications. And more recently, from us, we are really promoting Radiesse on the biostimulator as a biostimulator, and we can see great results from Dr. Tseng's technique on the face, on the abdomen, and also for the hands. And I really encourage doctors who are here today to try this out in their own practice. And I would like to ask the floor for if there's any question. We have a question from Dr. James initially, where she asks if Dr. Tseng can can share his experience with acne scar treatment with Radiesse, which Dr. Tseng has already shared his experience in combination with our therapy. Just wondering if there is any other question from the floor, Yan?
I think I can say something more about the acne scar. So considering the portfolio that we have with MERS, what you can do would be to first to use our therapy with the shallow transducers, the 3.0 and the 1.5 across the region of the acne scar. And then biostimulation with hyperdiluted Radiesse, use a blunt cannula to fan the product across the entire region. And if you want something that works more immediately, I would use bilateral balance with a 30 gauge needle, a very superficial injection just under the acne scar. And because many of the acne scar patients, they have been trying different treatment, PicoSure, fractionated CO2, fractionated urban yak, Fraxol, and they do see some improvement, but mostly the improvement was modest. So sometimes they are just getting tired and they want to see some fast result, immediate result. And that is when we can use bilateral balance. And I would use a 30 gauge needle, and with my needle aligned very parallel to the skin, and inject a very small bolus under that acne scar. And because of the good tissue integration of bilateral balance, even when they are injected very superficially under the skin, you don't have Tyndall effect. So that is one way that you can very fast improve the acne scars. And the volume to be used is very small. So usually when the patient has one syringe of bilateral balance, you may need only 0.2, 0.3 cc to address most of the acne scars to his or her face. And then you still have something more for the nasolabial fold, for the tear trough, for the malignant lines. And Yen.
Yeah. For my question, so do you have any advice for the doctor for the first use of Radiesse?
For what?
For the first use. For the first use in Radiesse.
First use.
Yes. Because some doctor, they really interested in Radiesse, but they afraid of some, as you know, that not dissolve it if they over using. Yeah. So
okay.
For your opinion, so you have any advice for them?
Right. Indeed, Radiesse, I would not say that Radiesse is something for beginners. Okay, because of its very strong projection. Indeed, I would expect a doctor to start with HA fillers, to start with bilateral. And then when he or she became a medium level injector, then it's a good time that we can start with Radiesse. And then he would appreciate the benefit of this very elastic product, because in the past, when he or she tried to use HA filler to project the mid-face, even though we can project the mid-face, but sometimes you also made this mid-face looking wider and bigger because it's just not strong enough. Okay, so to those kind of patients with a very thick soft tissue thickness, and then some softer product is not able to give you a satisfactory projection, then the doctor would see how Radiesse is able to project this small area very effectively, even when it's injected under a thick envelope of soft tissue. And also when we have problems in skin texture, like in the lateral cheek, when this lady in her 60s not only have some depression, volume issue, but also you see wrinkles, you see laxity in the skin, you see dryness in the skin. Then in addition to volumization, what Radiesse is able to give the patient is that after a few months, you see that the skin would look better, the skin texture would be firmer with a better light reflectance, or like in other indications that we just shared in the abdomen, in the laxity of the arms. So this is what we can use a biostimulator for.
Okay, that's great. Maybe the last question, how about the long lasting with all the patient for skin rejuvenation if you use the Radiesse?
How about what?
Long lasting. I mean,
okay, the longevity, the longevity. Yes. Okay, I would say that if we use Radiesse as a filler, and right after injection, when the volume is 10, with time it goes down, and in the first few months, this slope is slightly steeper because of the resorption of the CMC gel. So the CMC gel will be reabsorbed within 3 to 6 months. But what is left, like maybe 40–50% of the volume, and also the neocollagenesis, this is quite long lasting. So in some patients, even after a year and a half, 2 years, you still see some residual volume. You still see some residual improvement. But this is when we compare the before and after photos. But from a patient's perspective, when the result is lost for about 50%, what he or she would perceive is that it is gone. It's no longer there. So when you use it as a filler, it's better to ask the patient to come back 6 months after the initial treatment for some touch-up. So after this 1 or 2 touch-up, he or she can enjoy a much longer lasting and better result. But for skin texture, I found that the duration to last longer than volume effect. The improvement in wrinkles, it seems to last even longer when the volume effect had been decreasing. Okay, but so far, the consensus would recommend that you touch up after maybe 1 to 2 or 3 sessions of biostimulation. Ask the patient to come back 1 year or 18 months later for a touch-up.
Okay. Okay, so maybe another question will be send the email to our doctors and ask them if they have another question for you. And maybe I will send the email, for you to answer this question.
No problem.
But your today and your presentation is so great.
Thank you.
Okay, thank you. And thank you all doctor to join today.
Thank you very much, Dr. Tseng. Thanks, Yen, and all the doctors that have joined us today. Please do share if you have further questions later. Maybe later in the afternoon, it's really thought about a question. Please feel free to contact your representative in your respective countries. And for those who know me, you can message me directly, and I reach out to Dr. Tseng for clarifications.
Yes, of course.
Yeah. So,
okay, thank you very much.
So with this, I will end the session if no further questions, and have a good morning and the rest of the day. Thank you.
Okay, thank you. Bye-bye.
Bye-bye.
Bye-bye, Dr. Tseng.
Bye. See you guys. See you again soon.
Yeah.